My name is Dr. Sunny Srivastava. I'm a cardiologist at Pentucket Medical in Haverhill, and I am here for another program of Matters of the Heart brought to you by Haverhill Community Television, as well as our practice, Pentucket Medical. I'm here with one of my colleagues, Dr. Seth Bilazarian, and we're going to talk about a topic I think that many patients, if not most patients, express the most interest in, and often doctors might not be as well equipped as they should be to discuss it. So we're going to talk about diet and nutrition. And so with that, I will hand it over to Dr. Bilazarian.
Yeah, well, thank you for leading this discussion today. And you've been our usual expert on Haverhill Community Television on nutritional matters. And I thought it would be a good opportunity because very recently the federal government has come up with new dietary guidelines, which they update on every 5-year basis. And like many things, when these guidelines are updated, it can cause confusion because when there's change, people can get very frustrated. Is it margarine or is it butter, for instance? What about eggs? And the most recent guidelines made some changes. One of them was that we shouldn't worry as much about eggs. These kind of changes can cause a significant amount of frustration. Patients can throw up their hands and say, well, forget it, I'm just going to eat whatever, and that's not the message. The real message is that the nutrition science is changing and we're trying to understand better what to recommend and not what to recommend. On average, about 1/3 of doctors talk to their patients about nutrition, so it's not frequently discussed, and I thought this opportunity to have it available for our audience to know a little bit more about nutrition may be valuable. Just as a little bit of a historical perspective, many people have learned over the years that we should be very cautious about eating fat from animal sources when it comes to heart matters or vascular matters. What happened over the last several years, though, is that when people became very, very avoiding of fat foods, they began eating a lot more of carbohydrates, foods rich in sugar and grain. And these foods that are enriched with sugar and grain have been causing America to get fatter. There's been a rising amount of obesity and diabetes. So the pendulum swung so far to one direction. There's now an increased awareness that we have to be very cautious about sugar in addition to the fat. So we're going to talk a little bit more about that.
So you mentioned that just, 1/3 of doctors talk to patients about nutrition. What is it that you think are some of the challenges? Why aren't doctors talking about it all the time?
Well, I think that one of the issues that we talk about, and it's been written about, it's no secret, is that doctors are seeing patients in shorter time intervals. So we only have about 15 minutes to see patients, and we have a lot of things to cover. And nutrition is one of them. Of course, exercise, but there's medications and refills and medication reviews. And there's also often to discuss the active health issues. If a patient has a heart issue, congestive heart failure, coronary disease problems. So I think those are the issues. And of course, there also is a big issue is that physicians haven't really properly trained in nutrition. Most of us got very little training in this topic. But that's not an excuse because what I like to say is I got no training in how to use statin cholesterol medicines, but I learned how to use them because they came out after my medical school time. So I think that can be an excuse, but not an appropriate one.
Yep, no, I would agree. So let's maybe jump ahead because we don't have a ton of time about maybe some specific tips for patients here.
Sure. Well, I would say that what patients really want is, as much as possible, is really some clear answers if they can get them. And of course, there's not always clear answers, and that's really the problem. One of the things that I think is on the horizon that's not yet ready for prime time, but there are some mobile applications that are going to be available on your phone that you'll be able to take a picture of a food and get more nutrition information right from a picture. I think that's on the horizon. You'll either be able to scan the barcode on a product that you might buy in the store and it will give you the nutrition information, or just take a picture of it. So that's kind of an exciting thing that can really aid in, like, is this something that I should eat? How much sugar's in it? That kind of thing. But specific tips that I would say for heart patients, either patients who have heart disease or those who are trying to avoid heart disease, is a couple of basic concepts. And the concepts are the ones that I observe in my own effort to try to keep myself relatively not overweight. I certainly am overweight, but try to limit how much overweight I am. And that is that one of the things is if you make a commitment to a nutritional strategy, a good diet, a diet that's with proper foods and limits the quantities, you're going to fall off that wagon sometimes. There's going to be a point of a time where things are not going to always go. So don't use that as an opportunity to get worse, but just to sort of say that this is part of human nature and you're going to fall back into it. I mean, holidays, trips, those kind of things can happen. So that's the first thing. And I would say that if you indulge once a week, that's not a big problem. It's really the overall diet that we're really looking at. So if once a week or once every other week you have a particular food that may not be considered a healthy alternative, that's not bad. It's better than eating that kind of food on a regular basis. The next thing I would say is that we now are really recognizing that sugar or carbohydrates are really a major problem. And I mentioned that at the beginning. Avoiding fats, people eat sugar and carbohydrates, and by eating sugar and carbohydrates, that can be really problematic because people can gain a lot of weight. But not all sugars and carbohydrates are the same. The particular kind of sugars that are worrisome are the ones that are refined sugars, sucrose, so a table-type sugar, that's in a lot of processed foods. And I'll just skip ahead and say that there's a variety of different recommendations, but limiting that amount of sugar is really important. The American Heart Association has some recommendations. I recommend for patients who are actually trying to lose weight that you actually limit that to 15 grams of sugar per day. But the American Heart Association says that women can eat 24 grams and men can eat 36 grams. And that's readily available. I mean, you can look on a nutrition label and pretty quickly see what you're eating. For instance, a cup of milk or almost any dairy product has 8 grams of sugar. So you have a cup of milk with a sugary cereal, you're going to be up in the 20s before you get out of the house in the morning. So those kinds of things, just beginning awareness about sugar is really valuable.
And I would think many people think that they're eating, let's say, a cup of milk with some Special K,
right,
cereal, that they're doing the right thing, eating something that's very healthy, and they're getting a lot of sugar in that.
Right, milk. Exactly. And I try to counsel my patients who are open to this, like there are alternatives. Once you start becoming aware, you can start finding alternatives. Now, I'm not promoting this, but one example is almond milk that's unsweetened has 0 grams of sugar. Some people don't like the taste, but a lot of people say it's actually pretty good. I like it. Almond milk as an alternative to dairy milk, you've just lost 8 grams of sugar and you didn't really pay a price for that. It didn't really hurt to do that kind of thing. Those kinds of simple strategies. Orange juice is another thing that many people think, oh, this is a healthy thing, but a lot of sugar in fruit juices. The 2 diets that are most commonly recommended for heart health are the Mediterranean diet and the DASH diet. And those are really readily available on the internet. You can learn more about them. There's a lot of overlap, but they're enriched in fruits and vegetables. The DASH is low in sodium and really recommend that you avoid certain foods. And we'll talk a little bit more about that. The last couple things I would say is that just becoming more aware of nutrition labels. In my office, I keep a soup can, and I try to ask patients, and almost everyone fails the nutrition test when I ask them. I ask the patients, how much sodium is in that whole can of soup? And patients will say 410 milligrams, and the answer really is 1,000 because it's 410 per serving, and there's 2.5 servings in the container. So being aware of nutrition and how many servings are in it, and looking how much sugar or salt can be really very valuable. Just becoming aware of it, I think, is a recommendation. And I think that the more people become aware and start thinking about it, the better off they are. So a few consensus things. There's a lot of controversy in things, and we're going to get to the consensus view on diet in a second, but the consensus views about things is that one thing we should definitely avoid is trans fats. There may be some knowledge about what trans fats are. They can actually be hidden in the ingredients. If you see in the ingredients something called partially hydrogenated, that means it's a trans fat. And trans fats are the worst. They're toxic. You should really run away from them. But they're in a lot of processed foods. They used to be in a lot of the friolators at fast food companies because it keeps the fat longer. It's a chemical change to the fat that lets it be preserved longer, but it's bad for us. And most of the large fast food restaurants have changed from trans fats and are no longer using it. But that's one thing that's really a consensus view we should really avoid. And we should limit the amount of saturated fat from animal products. So there's a lot of saturated fats in different kind of foods, like a vegetable and avocado has a lot of saturated fats, but it's preferred to have it from a plant-based option than an animal-based option. So not saying you shouldn't eat any animal products, but limit it would be preferred. Avoiding sugars, I already said, 48 grams is the recommendation from the 2015 Dietary Guidelines that just came out. So 48 grams per day, but getting that down much lower is a really way to be effective at weight loss. 15 grams might be a strategy recommended by one book. And then we want to try to think about low carbohydrate diets if possible, but low carbohydrate diets can be a problem again, because if you take on a low carbohydrate diet with really limiting sugar and carbohydrates, and you enrich it with a lot of animal fats, you may lose weight, but you're really not helping your heart and blood vessels. So we want a low carbohydrate diet that respects low animal fats, so a Mediterranean type diet as a strategy. So all of these goals are really highly recommended to avoid abdominal obesity, the obesity that comes around our belt line. That is the particular kind of overweight or obese status that contributes significantly to many of the medical problems that we currently endure. The diabetes, vascular issues, sleep apnea, a variety of these problems. So if we can try to stay lean in the abdominal area, that would be really significant.
Great.
So let me just lastly just say a few things about the issue about the Mediterranean diet. The Mediterranean diet is a particular diet that was developed, or actually is eaten by the people that live around the Mediterranean. So in Greece, Italy, southern Spain, southern France, North Africa. So all these countries eat the so-called Mediterranean diet. And the Mediterranean diet was written about in the 1950s by a physician that traveled around the area. It would have been a nice job for us. and recorded what people were eating and noticed that people had lower rates of heart attack and vascular problems. Much of the diet was based on just being poor. So a family would have one animal, like one lamb or one goat, and that would be all the family would eat for meat for the entire year. So that was one of the contributors to it, is that they were eating a more sort of less meat-enriched diet. But one trial that came out a year ago, done in Spain, called the Predimed trials, published in the New England Journal, had a 14-point scale in which they gave people a Mediterranean diet and they encouraged them to use the Mediterranean diet. And they found a 10% reduction in cardiovascular events, including stroke, when they ate this Mediterranean diet. And the 14 points of the diet are olive oil, vegetables, fruits, wine, legumes, which are beans, those kinds of vegetables, fish or seafood, nuts, poultry, and something in Spain called sofrito sauce, which is a sauce made from tomatoes, onions, garlic, and aromatic herbs. So those things I just mentioned are things that are encouraged, and the things that are discouraged are red meat, butter, cream, or margarine, soda, and cakes or sweets. So of the 14, there are 4 that are to be avoided and 10 that are encouraged. And if you do at least 9 of them, you're considered to be following the Mediterranean diet. So you can ask your doctor or go on the web to learn more about the Mediterranean diet. There are some basic strategies that can be recommended for improving it. There are 9 simple strategies. If you actually look on the web and search 9 simple strategies for eating the Mediterranean way, you'll find some good strategies. So that's about a quick summary of good nutrition recommendations for heart and vascular disease.
Thank you. I know a lot of our patients ask about this routinely, and so it's a great review. And so with that, we are running out of time. That was another episode of Matters of the Heart. Please stay with us, as we will be back shortly with another episode.